All right, thank you, thank you. We're going to get started with our next panel. No, he's
You guys, 28 years ago, my maternal grandmother from North Africa came to visit us in New York City. This was the first time she was visiting us in New York City, so we were all really excited to have her. But then I got to tell you, a couple of weeks into her visit, she ended up having some chest pains. And my mother at the time told me, hey, we got to take your grandmother to the hospital. Now, I didn't really know what that meant at 11 years old, and I can't tell you that I fully appreciated the magnitude of what she was going through, but I knew my job was going to be really important because my role was to translate for my family. At the time, I was the only person that was speaking English in my household. We walk into the hospital, we have the conversation with the physicians, and the physicians quickly suggest we have to admit her into the hospital for observation. At that point, I knew something pretty serious was happening, and when I translated that back to my family actually chose otherwise. They chose to get a prescription and decide to take her home. Now, on the surface, that decision was based on economics. My family at the time perhaps couldn't afford this notion of admitting her into the hospital and not knowing what the financial consequences of that may be. But in reality, it was much deeper than that. In reality, it was based on a lack of trust with the healthcare system. In reality, it was walking into a hospital where we didn't necessarily feel like we were represented. In reality, it felt like maybe we weren't seen, we weren't heard, we weren't acknowledged in a certain way. And that level of lack of trust is probably what led to the decision. A couple of months later, she migrated back home, and shortly thereafter, she passed away of cardiac arrest, something completely avoidable if managed the right way up front. And ever since then, I've been on a mission personally to save and sustain human life through healthcare innovation and making sure that we provide access to it. Now, fundamentally, that means identifying scientific innovation, it means identifying medical technology innovation and making it accessible. And that's where I found a home at Johnson & Johnson. Johnson & Johnson has a 100+ year track record of advancing healthcare for humanity. And I found a home there because my purpose and that mission squarely aligns. And what I was really surprised at, but really pleasantly happy to see at J&J, was they have this thing called Credo. This Credo is a set of values. This Credo is our guiding document. This Credo puts the patients and their caregivers and providers right at the center. And with that Credo in mind, with that patient at the center, we've decided that it is not enough to simply advance healthcare by providing innovative medicines and medical technology. It's imperative that we close health equity gaps in the system to make sure that the innovations that we introduce reach the patients that need it the most. And that's why in 2020, we started something called Our Race to Health Equity. In short, the acronym is ORTHE. This Our Race to Health Equity is a $100 million commitment in 2020 to close health equity gaps wherever they may exist in the system. And as part of that journey, we came across this opportunity with Illustrate Change. Illustrate Change is an opportunity to ensure that the color of your skin, your economic position, and even just where you live does not determine the quality of healthcare that you receive. So the person I'm about to introduce started this movement, and I'm humbled to share the stage with him because this person was sitting in Africa, and he realized that 5% of all medical illustration in textbooks that educate healthcare providers are actually people of color. The default is white. The models that are used in healthcare education for physicians and all other healthcare providers are not representative of the communities that they reach. In fact, in the United States, the most healthcare advanced country in the world, it's said to believe that 50% of dermatologists will tell you they are feeling inadequately prepared to treat patients with skin of color because all they know in their training is training on white skin. So this person said, hey, 5% is not enough. And he started with one illustration that went viral. And then the Deloitte team that is joining us up front here found it and said, we got to put some energy behind this, and that's where Johnson & Johnson then jumped on the journey, and we've been working on this ever since. I'm going to introduce him. He's going to tell you all about his journey, but what I would also share with you is this young man is not only a medical illustrator, this young man is a medical student, this young man in a short period of time is a TEDx speaker, this young man in a short period of time is an author, this young man in a short period of time is a founder of an NGO in Africa to champion change. And this young man is starting a movement that we, as the biggest and most diversified healthcare company in the world, are joining him on. So with humility and with a lot of admiration, let me introduce you to Mr. Chidiebere Ibe, coming straight from Nigeria.
Hi, everyone. Hello, good afternoon. Thank you so much, Mohammed, for that introduction. And I heard my bio and I was surprised. Is that actually me? You know, how can a small man like me have so much bio? But I'm super excited. So I know people have difficulty in pronouncing my name, so I'm going to take it very slowly. It's Chidiebere Ibe, of course, not so hard, you know. So I'm excited to be here at Cannes, and this is my first time in Cannes. And it's a lot going on here, actually. And super excited for this project, collaborating with Deloitte and the Johnson & Johnsons. So a little about my journey into illustrations. I'm actually from Nigeria, to be precise, and born and raised in Nigeria. I started illustrations in 2020 during the lockdown, and it was very difficult for everybody. So for me, I was just a young boy in Nigeria, you know, trying different things, designs, photography, videography, and I had this passion for medicine because I lost my mom to cancer 25th December 2011. And that particular day, I said I was going to be a doctor. And from that day onward, it has been an amazing journey, learning so much skills, harnessing skills, and to where I am right now. For me particularly, it has been a fantastic journey. And I can tell you that without diversity, creativity remains obviously very stagnant. And I've given so much talk around the world. I've given a TED Talk. I've given so many presentations. I always love using this image in my presentation because this is the last image I had with my mom. And you can see I was standing very close to her because I was basically her favorite. And, you know, and I know how to treat women very right because I would always give her meat pie and so much amazing things. And so she held so much meaning to me personally. And that's why I always love talking about her because she raised a man out of me. And the reason for my passion for medicine and for illustrations is because of her. And in my journey to illustrations, I always make a 1-hour travel from my house to my church every day to get power supply, to charge my laptop. And I had a very bad laptop as a then. And I used a computer mouse to create illustrations. So it was really a tough journey. But all the journey together was what really made my journey illustration worthwhile. And for those who ask me if I was a born artist, I'm not a born artist. I actually taught myself how to draw from the scratch. And that was my first drawing. It was very beautiful as at then, you know. But now, I started going to illustrations, and this was basically my first medical illustration. And to be very honest with you, I don't know what this meant as at then. I was just trying out things and trying out, you know, amazing things. But one thing was very important was that I ensured that the skin was black. And that's how it all started. Over the years, I got better in my illustrations, in my artworks, and I was able to achieve, you know, a lot of this basically. So, but people ask me, what is the importance of representation? What really inspired you to create visuals that represent people of color? For me, in 2020, I was making a research on the internet, and I saw that most images over the internet was basically showing white people and not the people of color. And I thought, how can I make this a different, you know, make it very different? Then I started creating visuals that represent people of color. And statistically, it's been proven that less than 5% of images in a medical textbook show people of color. And it's a very striking number because most of the images do not show people of color. And that's why Illustrate Change is here to address that problem. If you Google right now, medical illustration, you will see that most of the images you see are something of such. And the question is, do black people not have anatomy? Do black people not have diseases? Don't they have skin conditions? Right, that's the question to ask. And that's why Illustrate Change is here to change and to change that perspective. And in 2021, I created an image that went viral because usually this is all what we see in our textbooks. White fetus, on white fetus, basically like in a white mother. And in 2021, I created this image and it went viral. And people started asking questions. Oh, yes, you can do that again. You can actually do that again. Thank you. So in 2021, I created these and it was featured on CNN, Wikipedia, Forbes, CNN, and the rest. And people started asking questions. What is the significance of this illustration? What does it really mean in the healthcare space? And this image was at a time where healthcare was more of, right, a privilege, right? You should be, as a white person, you should be privileged to receive healthcare. As a black person, you should be privileged to receive healthcare. And statistically, black women are 3 to 4 times likely to die from birth complication than white women. Because if you are a black mother and you're pregnant, you are assumed to have high tolerance for pain than a white woman. And that's why the significance of this image is very important. And it was featured on a couple of media out there. But important thing is that one image is not enough, right? I've created a black fetus. It has gone viral, but it doesn't end there. We need to give people the access to these diverse illustrations. And together, I believe, Illustrate Change is creating one of the largest and fast-growing library of diverse illustrations. But you see, it doesn't just end there, because we are looking towards partnering with other organizations to populate this site with diverse illustrations. And Mohammed here would agree with me that, that Illustrate Change, right, this is what it looks like. This is what creating diverse illustration basically looks like. And for me, creating this diverse illustration is not just about creating black skin, but it's about telling stories of patients who have gone through racism from their physician. And I had a story of a mother who shared an experience with me that she shared these images with her child, and her child said that, I see myself now, then I have reasons to study medicine. It's amazing to see how a single image can spark conversation in the healthcare space about lack of representation. And now we've partnered with the Johnson & Johnson's and with Deloitte to create this wonderful Illustrate Change project, because we have this idea that people should have access to these images, people should have access to diverse illustrations, because I believe that visuals can improve healthcare outcome, right? If you're looking towards improving healthcare outcome for our patients, it is important to give them images that represent them. In my own idea, in my own perspective, healthcare is for all. In as much as we have, diverse race, diverse ethnicity, healthcare should cover everybody that we basically serve. And this is what the site basically looks like, and it's really fantastic, because we've covered so much in the healthcare space, like psoriasis, like glaucoma, lung cancer, and preeclampsia, atopic dermatitis. And it interests you to know that for cases like sickle cell disease, if you're an African and you have sickle cell, you are assumed to be a drug addict. And with this project, we are looking towards changing the perspective of people towards black people. And I strongly believe that this project is one of the best of its kind out there, and it's really fast growing. So now, I really want to employ my amazing panelists. What do you think about this project, basically? About Illustrate Change, and it's basically...
He's going off script. He's going off script. Listen, I think, importantly, like we talked about earlier, healthcare is a human right, not a privilege for some and not available for others. Especially quality healthcare that affords people a chance to, again, live a lot more sustainably, even in the most developed countries in the world. So I think what this project does, which I think is probably the insight behind the images, is number one, it improves trust with the patients, with the healthcare system. I was introduced to an amazing young man yesterday from Deloitte who actually found this project for Deloitte and started it from a grassroots perspective. He goes by the name of Shamel. I understand it's also now Mel Creative. He's sitting in the front seat. You need to holler at him. But what he talked about was the first time he saw this image, he was expecting his 11-month-old son, was in the OBGYN office with his beautiful wife. They looked up at all the images, and all the images didn't represent them. And he walked into then the office with the OBGYN and had a conversation. Even though he was receptive of the information, he had a guard up. He didn't necessarily see himself in the office walking in. That naturally puts a firewall up where his consumption of that healthcare conversation is going to be fundamentally different. If he would have then saw that image on the wall, that firewall would have been down, that trust factor would have been heightened, and that interaction with that healthcare provider in that healthcare system could have been fundamentally different. And that's then when he saw this image and said, hey, we can do more. So step number one is it creates trust between the patient and the healthcare system. Number two is then it creates a better education platform for providers to be able to understand and appreciate all of the different disease states that they see. I mentioned earlier 50% of the dermatologists feel inapt in treating patients of color. I'll give you one more statistic just for contemplation. 63% of providers will misdiagnose skin cancer on black patients, but only 12% will misdiagnose them on white patients. They're just not trained to see it. They're just not trained in their curriculum to appreciate it. So if something looks red on white skin, it might look a little bit differently on darker skin. If something looks inflamed on one skin tone, it might look fundamentally different on another. And that's why this young man, with the movement that he started, is not only improving trust, but is improving the healthcare education ecosystem, which then improves patients and providers being able to deliver and to receive quality healthcare. So congratulations on the journey, and obviously thanks for letting us be here with you.
Thank you so much. Thank you so much. And just to buttress on that, I took a course last semester in school in pathology, and it was amazing to know that all the resources used in teaching medical students in Africa were all white-centered. And I asked myself a question: how does this represent on a black skin? And I think it's really a problem because we as Africans, basically, we have this idea or this mentality that we are not enough, basically, right? And the idea about this project is to ensure that people of color have confidence in their own skin, right? Because if you're confident in your own skin, you have confidence in working in a hospital and talking about your personal issues with a physician. Because I strongly believe that we need to build trust, as Ella said, with a physician, and visuals, right, are one of those measures that we can build trust and also changing perspective about people. Because as Elia said, there's this cliche that if you're a black person, that your nerves ending are less sensitive to pain, so therefore you don't need pain medications for your own problems. So I think the cliches about black people is a wrong perspective that we need to change. And I believe that creating illustrations that represent people of color is a start. It's a very good start to changing people's perspective about black people. And this is not about your social status, not about your money, because the case of Serena Williams, which she had gone through some sort of bias from her physician, she had so much money to afford good health care, right? But her physician literally said her to shut up because she's a black person. So you see, it's not about who you are or your money, but it's about your skin color. And I believe that making visuals that represent people of color is a better approach to addressing that perspective.
No doubt. Chidi, I want you to maybe just talk a little bit about the stories behind the images. That's, from afar, you look at the images and you think they demonstrate a certain disease state. But when you're putting great care in them, you're doing it also to tell a story. Maybe give one or two examples of a story that you've been telling. The breastfeeding story yesterday that I heard from you was really compelling for me.
Yeah, so one of the images we've created for Illustrate Change is breastfeeding. And it would amaze you to know that black people are not allowed to breastfeed in public. I had a story of a mother who shared an experience with me that she was breastfeeding in public, and the waitress came to her and said that she should breastfeed in the toilet. And she asked the waitress, "Do you eat in the toilet?" And she couldn't answer. So that's one of many stories of black people who had gone through some sort of experiences from people who assume that as a black person you shouldn't have equal health care and you shouldn't be given equal attention. And that is one of many stories, like the story of ovarian cancer. For me, I believe that it's not just about creating black illustrations, but creating images that tell stories, all right, of patients who have gone through such experiences, right? Because one thing these images did was that it sparked up a difficult conversation. People started telling their stories. People started, becoming more confident in their own skin. People started talking about their own personal experiences. I created an image of ovarian cancer because I lost my mom to ovarian cancer. And for me, that is me telling my stories in as much as I'm accurately educating people about ovarian cancer. So I feel that there are stories behind every illustrations, and not just about, in dermatology, something called Fitzpatrick scale, right, which shows skin tone from a light skin tone to a darker skin tone. So for me, I ensure that the dark skin tone, which is skin tone 6, is accurately represented. Because sometimes you see that we talk about black illustrations, but we make them on brown skin. How about the black skin? Because this represents very differently on skin tones. So it's important to ensure that not just brown skin are represented, but black skin are also represented accurately.
That's exactly right. Chidi, just for the audience real quick, talk a little bit about your vision for the future for this. Because where you go, we'll go. So we want to know where you want to go so we can make sure we come with you.
Yes, as earlier said, so Illustrate Change is actually a fast-growing project and one of the biggest out there. So we're looking towards populating the website with over 100 illustrations in a couple of years. And not just that, we are partnering with AMI to ensure that other illustrators join the work for us. Other illustrators are, also contributing to Illustrate Change. Because as earlier said, one image is obviously not enough, right? This is a project. We're looking towards partnering with this fellowship to ensure that we populate over 100 illustrations on this site. And I believe that in coming years, right, we would have more than 1,000 illustrations. And not just that, we will spark interest in other illustrators. Because when the image went viral in 2021, I had artists who reached out to me and said, from now onwards, all my artworks are going to be black-centered, right? To see how a single image has sparked up interest in other illustrators in their work. So I believe that in the coming years, we would have more than 1,000 illustrations on this site, and we will have healthcare for people of color improved. And not just that, but in our textbooks, which is one of the avenues medical students use in training, we'll have more black images in medical textbooks. And I believe that the less than 5%, right, would be more than 90% in coming years to come. And I'm so optimistic about it, and I really hope that this project, become a long-lasting project, and that we see more that can come out of it.
I love it. And look, I think it's also important to note, again, you have some of the Deloitte leaders up front here. Between Deloitte and J&J, we're partnering not only to support the initiative, but taking the illustrations and helping Chidi, who's already a medical student, so he already has a leg up, to assess medical accuracy, because we don't want to be in a position where the illustration, for whatever reason, right, whether it's penmanship or, just the creative process, not demonstrate the accuracy of the medical illustrations, so that we can make it more than just beautiful art. We can and then embed them in the healthcare system for both providers to be educated and for patients to also appreciate. So that's part of the journey as well.
Great, awesome. Great.
So look, I think we're gonna wrap. I'm looking at the audience to see if there's any thoughts there. But let me just tell you something personally here. Over the last 48 hours, I've known of Chidi from Johnson & Johnson before I got here. Obviously, his story is profound. This young man, I'm leaving inspired from. Not only did he lose his mother at a really young age, which we all can appreciate is probably devastating in and of itself, he used that hardship to get on a very different journey. And then he found himself having a natural gift as an artist. And then he found himself with a purpose and passion for medicine, and combined hardship with what he loves. He combined what he was afraid of with what he was good at. And you see here a movement that, if started by anyone else, any other place in the world, probably would not have gotten the traction because of the love and the energy and the momentum that he's put into it. And for him to do that, yeah, give it up. And look, for him to do that, he's gotten one of the biggest, or two of the biggest organizations in their class, not only to support it, but to admire it. So you leave here not only with a tremendous amount of momentum and energy, but you leave here inspiring folks, whether they be in the audience or maybe who've had the pleasure and fortune of sharing the stage with you. So thank you for being you. And I'm excited for what you're about to accomplish, not only 10 years past, but 10 years forward, because we'll be close either way.
Of course. Thank you so much.
Before you guys go, I just want to say, oh, there's a question. But I just want to say how this all came together. We were doing a session at Deloitte Digital yesterday, less than 24 hours ago. And I saw the images because they have them on such beautiful display. And we stopped, Fran and I stopped to say, what is this? It's such beautiful artwork, right? And they explained to us what it was. It's this movement. And the movement is so important because imaging is so important. When you see yourselves, you identify yourself with yourself. And so we thought that this would be the perfect stage for you guys to be on. So we're grateful for your flexibility and grateful that you stepped up. We have a question I see on the other side. So I'm going to let you ask the question.
So I was just at Rutgers University, the Global Center for Health, and this issue came up, and I wish I've known about you. There were 35 scholars in the room talking about global health and racism, and your name should have been in the room. And I'm going to make sure I take it back to that room, to that group of scholars. My question is about colonialism and its post effects and colorism that comes out of colonialism, right? Self-hate. What has been the reaction from people of color who have been under the thumb of colonialism in Africa? We know that in certain parts there is the attempt to lighten skin, to escape their dark skin. Have you gotten any pushback from people in that context? And how do you respond to that pushback?
All right. Thank you for asking that. It's really a tough question, but I'm going to try. So for me, I've had several of setbacks, several of pushback. And, the idea behind being a black person and accepting to be a black person is a different story entirely. Some years ago, I think in the 80s, right, a research was carried out called the Black Doll Test. And the test was to ensure how black people perceive themselves. So the two dolls were kept, the white doll and the black doll. And the black kids were asked, which of these dolls had a negative characteristics? And they pointed at the black doll. And the black kids were also asked, which of the doll had a positive characteristics? And they pointed at the white doll. And then they were asked, which of the doll looked like you? And they were start to realize that the doll that they pointed at, right, was the doll that looked like them. So it came to understand that black people themselves, right, do not feel confident in their skin, one, and they are exposed to so much stressors. And recently I was making a research that racism itself can cause tumor. It's amazing to know that, right? Because you are exposed to so much stress, you're exposed to much hatred, and it's caused an increased cortisol level, and that which can lead to adrenal tumor, basically. And this is the reason why black people are always, thinking less of themselves, thinking not confident in their skin. And this has also affected me as a person. Because, the story behind the whole project that, he's a black boy from Africa making this move, it wasn't something very accepted by people. I had so much hate from people, and they're like, why are you the one making this project? And I had people who said that for like 30 years, I've been an artist. The world should be celebrating me and not this boy. It was so much of hatred, so much of, backlashes that came towards me. And one thing I understood was that making a change is difficult, and people are going to hate on you, right? But for me, I just had to embrace everything. I had to accept it, and I had to keep on doing it. And for me, it is something that has come to stay, basically. And in as much as the hate is there, as much as the backlashes and everything is coming at me, I feel I'm doing something great, and I feel happy doing it. So no matter what comes at it, I'm willing to take the course. I'm willing to take, the backlashes. And I'm happy that I have people who are here to support me. People are here to also encourage me, because it is not easy driving a change like this. And also changing, for me, I have a concept that to change the mindset of people, you need to replace it with an existing and superior information, right? And that's what I'm literally doing right now. And it's not easy. It is very difficult. But I really enjoy doing it, basically. Yeah.
Well, I think everybody in this room supports you. Is that not true? Clap, give it up. Give it up one more time. I think everybody supports. This is incredible. Absolutely incredible. That was going to be our only question from the panel, so I just wanted to thank you guys so much. And now I'm making all this noise. But thank you guys so much.
Thank
That was
you.
incredible.